Bipolar disorder. Bipolar disorder is characterized by extreme mood swings, including episodes of mania, high energy, reduced need for sleep, and often euphoria, and depression, low energy, sadness, and loss of interest in activities. These episodes can last for days, weeks, or even months. The mood swings in bipolar disorder can significantly affect daily functioning and quality of life. Treatment often involves mood stabilizers, such as lithium and psychotherapy, to help manage symptoms and maintain a stable mood. Regular monitoring and support from healthcare providers are crucial for managing the condition. Depression. Depression is a mood disorder characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities that were once enjoyed. Individuals may experience changes in sleep, appetite, energy levels, and concentration, along with feelings of guilt and worthlessness. Depression affects how a person feels, thinks, and handles daily activities. It is often treated with a combination of medication, such as antidepressants and psychotherapy. Cognitive behavioral therapy, CBT, helps by addressing negative thought patterns, while lifestyle changes, like regular exercise and a healthy diet, can also manage symptoms effectively. Attention deficit/hyperactivity disorder, ADHD. ADHD is a neurodevelopmental disorder characterized by symptoms of inattention, hyperactivity, and impulsivity. These symptoms can interfere with functioning or development in multiple settings, such as school, work, and home. ADHD is commonly treated with medication, such as stimulants, for example, methylphenidate, and behavioral therapy to help manage symptoms and improve daily functioning. Organizational strategies and behavioral interventions are also helpful in creating structured routines and managing time effectively. Schizophrenia. Schizophrenia is a chronic brain disorder that affects how a person thinks, feels, and behaves. Symptoms include hallucinations, seeing or hearing things that aren't there, delusions, false beliefs, and disorganized thinking. It can also cause reduced emotional expression and social withdrawal. Schizophrenia requires long-term treatment, including antipsychotic medications to manage symptoms and psychotherapy to improve social and occupational functioning. Supportive therapies and social services can help individuals with schizophrenia lead more independent lives and integrate into society. Anxiety disorders. Anxiety disorders encompass a group of mental health conditions marked by significant feelings of anxiety and fear. These include generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, and specific phobias. Symptoms can include excessive worry, restlessness, and physical symptoms like a rapid heartbeat. Anxiety disorders can interfere with daily activities and relationships. They are often treated with therapy, such as cognitive behavioral therapy, CBT, and medications like SSRIs or benzodiazepines. CBT helps individuals understand and manage their anxiety by changing negative thought patterns and behaviors. Post-traumatic stress disorder, PTSD. PTSD can develop after exposure to a traumatic event, such as combat, natural disasters, accidents, or assault. Symptoms include flashbacks, nightmares, severe anxiety, and uncontrollable thoughts about the event. Individuals may also experience emotional numbness and avoidance of reminders of the trauma. PTSD is treated with therapy, particularly cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR. Medications like SSRIs can also help alleviate symptoms. Support from loved ones in a safe environment are crucial for recovery. Therapy aims to help individuals process the trauma and develop healthy coping mechanisms. Eating disorders. Eating disorders involve abnormal or disturbed eating habits and include conditions like anorexia nervosa, bulimia nervosa, and binge eating disorder. Symptoms can range from severe food restriction and fear of gaining weight to episodes of binge eating followed by purging. Eating disorders often require a combination of psychological therapy, nutritional education, and medical monitoring for treatment. Cognitive behavioral therapy, CBT, is effective in addressing the underlying thoughts and behaviors related to the disorder. Treatment aims to normalize eating patterns and address any psychological issues contributing to the disorder. Autism spectrum disorder, ASD. SD is a developmental disorder characterized by difficulties with social interaction and communication, and by restricted and repetitive behavior. Symptoms vary widely in severity and can include challenges with understanding social cues, making eye contact, and engaging in imaginative play. Treatment involves a range of therapies and interventions, such as speech therapy, occupational therapy, and behavioral interventions like applied behavior analysis, ABA. These therapies aim to improve social skills, communication, and behavior. Early intervention can significantly enhance development and quality of life for individuals with ASD. Social anxiety disorder. Social anxiety disorder is characterized by intense fear and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or negatively evaluated by others. Symptoms can include sweating, trembling, and difficulty speaking in social settings. Treatment usually involves cognitive behavioral therapy, CBT, to help manage anxiety and improve social interactions. Medications like SSRIs or beta blockers may also be used to reduce symptoms. CBT focuses on challenging negative thoughts and gradually facing feared social situations through exposure therapy. Borderline personality disorder, BPD. BPD is characterized by unstable moods, behavior, and relationships. Symptoms include intense episodes of anger, depression, and anxiety that can last for a few hours to days. Individuals may also experience feelings of emptiness, fear of abandonment, and impulsive behavior. Treatment typically involves therapy, such as dialectical behavior therapy, DBT, which focuses on teaching skills to cope with stress, regulate emotions, and improve relationships. Medications may be prescribed to manage mood swings and other symptoms. Support from mental health professionals and loved ones is essential for recovery. Obsessive-Compulsive Personality Disorder, OCPD. OCPD is characterized by a chronic preoccupation with rules, orderliness, and control, leading to perfectionism and a need for interpersonal control. Individuals with OCPD may be overly focused on details, rules, and schedules to the detriment of flexibility and efficiency. Treatment often involves cognitive behavioral therapy, CBT, to help manage the perfectionism and control issues. Therapy aims to reduce the need for orderliness, improve flexibility, and enhance interpersonal relationships. Medications may also be used to manage associated anxiety or depression. Panic disorder. Panic disorder is characterized by recurrent, unexpected panic attacks, sudden periods of intense fear or discomfort that peak within minutes. Symptoms include palpitations, sweating, trembling, shortness of breath, and a feeling of impending doom. Treatment typically includes cognitive behavioral therapy, CBT, and medications like SSRIs or benzodiazepines to help control panic attacks and reduce anxiety. CBT helps individuals understand and manage the triggers of their panic attacks and develop coping strategies to prevent future episodes. Obsessive-Compulsive Disorder, OCD. OCD is characterized by unwanted recurring thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, that the individual feels driven to perform. These behaviors are often performed in an attempt to reduce anxiety or prevent a feared event. OCD can interfere with daily activities and cause significant distress. Treatment typically includes cognitive behavioral therapy, CBT, particularly exposure and response prevention, ERP, and medications like SSRIs. CBT helps individuals confront their fears and reduce compulsive behaviors through structured exposure to anxiety-provoking situations. Specific phobias. Specific phobias involve an intense, irrational fear of a specific object, situation, or activity that is generally not harmful. Common phobias include fear of heights, acrophobia, spiders, arachnophobia, and flying, aviophobia. Treatment typically involves exposure therapy, a type of cognitive behavioral therapy, CBT, to gradually and safely expose individuals to the feared object or situation. Over time, repeated exposure helps reduce fear and anxiety, allowing individuals to manage their phobias more effectively. Generalized anxiety disorder, GAD. GAD is characterized by excessive, uncontrollable worry about various aspects of daily life, often accompanied by physical symptoms such as restlessness, fatigue, muscle tension, and difficulty concentrating. Treatment often includes cognitive behavioral therapy, CBT, to help individuals develop coping mechanisms and strategies to manage their worry. Medications like SSRIs or benzodiazepines may also be prescribed to alleviate symptoms. Lifestyle changes such as regular exercise and mindfulness practices may also help. Thanks for watching. Subscribe if you like the video